let's start first with Obamacare. It hasn't been working perfectly. The Republicans are right about that. What's the main thing that needs to get fixed?
Well, the individual insurance market is the thing that needs to get fixed. You have areas of the country where there's a single insurer. People are still worried about the premium escalations. So it's the individual insurance market that's had the most trouble. Healthcare.gov did not roll out particularly well. I do think that the Medicaid expansion has worked very well for those states that expanded Medicaid.
Well, you specifically talk about Medicare and Medicaid. That's one of the things the Republicans are talking about changing.
Yes.
Saying basically, let's just do a block grant. We'll write a check to the states. States, you take care of it. What would be the effects of that in your view?
Devastating. I think you'd be ending up taking about $1 trillion out over a 10-year period of time. There's no question that the cuts that would happen with block grants would result in less people getting Medicaid. Just reversing the expansion alone in New York State would be $5 billion. And that's why you see governors like Governor Kasich of Ohio saying, don't take back the Medicaid expansion. Or Senator Capito in West Virginia saying, hey, wait a second, we've got 150,000 more people now on the Medicaid rolls. Do you really want to roll that back? So I think that would be highly problematic.
So one of the effects of Obamacare was clearly more people got insured. We have a chart here actually to show the percentage of people who are uninsured and how it went down under Obamacare. You can see just off to the right there.
Yes.
It plummets,
yes.
Basically. There's like 23 million to 26 million Americans. What would happen if a good portion of those just came off of insurance now?
Well, there's a difference between access and insurance. Access means that if you get sick, you can get care, but that's part of the problem we had in this country, which is if the first time you come into the healthcare system, you've had a heart attack, you've had a stroke, you're diabetic, you have multiple issues with yourself, that's extremely expensive. So access to care doesn't mean insurance. Insurance means you can get preventive care, and hopefully over a long period of time you can bend the cost curve. People smoke less, people drink less, and so on and so forth.
You run not only a great hospital, but a very big business. What would be the business effects of these sorts of reforms on your hospital?
First, I think we got to think about it in human terms, to be honest with you. We want to take care of everybody. 30% of the patients we care for are Medicaid. People don't realize that.
Really? 30%?
Yeah.
That's
one out of every 4 New Yorkers is on Medicaid. And you see this around the country. So when we're talking about equality or inequality, access to insurance and health care, I think, is very important. For those states that didn't expand Medicaid, to me, I think it's appalling. A state like Alabama, you have to make less than $4,000 a year if you're a family of 3 for the parents to qualify for Medicaid. At some point as a country, we have to say we want to do that. Now, that 30% of patients we care for that are Medicaid, that's only 17% of our revenue. So Medicaid doesn't cover cost. So that's an issue for us if Medicaid reimbursement continued to go down.
So finally, there's a lot of talk going on in Washington right now. Are you part of that talk? Are they talking to you? Are you consulting with them about what makes sense, what doesn't make sense?
All the time. And I think that the Republican-Democrat divide is not as big as people think. I really believe that behind closed doors, people of real patriotism, real Americans can figure this out.
But does that suggest that it may not be as radical a solution as we've been led to believe?
I think Obamacare was directionally correct. I think gutting it and the plans that I've seen that the Republican House wants to put in would gut it, I think would take us back to square one, which I think is unfortunate.
But it'll take a while to work this through.
Oh, it's going to take a while to work it through, absolutely.